In healthcare, improvement starts with listening, not just to the data, but to the people experiencing the system every day. One way we listen to the people is by capturing the voice of the customer. In this context, customer doesn't just mean a paying client. It means anyone impacted by a process or service in the delivery of care. That could be a patient, a family member, a nurse, a scheduler, a physician, or anyone who relies on or contributes to how care is delivered. The voice of the customer refers to what these people involved in the process express directly or indirectly about their needs, preferences, frustrations, and experiences. It includes what people say during interviews, what's captured in complaints or surveys, and what you hear during informal conversations or Gemba walks. It might even show up in staff workarounds or patient behaviors that suggest something isn't working. This kind of information gives us valuable insight into how the system is functioning from the ground level. But listening alone isn't enough. We also need a way to make sense of what we're hearing. That's where empathy maps can help. An empathy map is a simple tool that helps teams organize what someone might be seeing, saying, doing, hearing, thinking, and feeling. This is organized in relation to a specific situation or process. It turns individual comments and observations into a broader understanding of that person's experience. For example, imagine you're working on a project to improve follow-up after hospital discharge. You've gathered feedback from patients and staff and conducted a few Gemba walks. You also conduct interviews with the patients. You learn that patients often say they didn't realize they needed to schedule a follow-up. Nurses say they are too pressed for time during discharge to do thorough discharge education. You notice discharge paperwork is long and rarely reviewed out loud. Now you might use an empathy map to better understand the patient's experience. Who are we empathizing with? The patient. What do they need to do? Schedule follow-up after discharge. With the information you gathered from patient and staff interviews as well as Gemba walks, you determine common experiences to be that. They see the personal items they need to collect before leaving, people waiting on them, a packet of papers handed to them by a staff member. They say, I thought someone would call me. They do. Wait at home uncertain about next steps. They hear sounds in the room, an alarm in the hallway, as well as the nurse asking them if they have any questions about their discharge paperwork. They think, I don't want to mess this up. They feel confused and a bit anxious. They also feel glad to be going home. The voice of the customer gives you the raw data. The empathy map helps you visualize and internalize it, turning disconnected data points into a more complete picture of a real person's experience. So, how do these tools relate? Voice of the customer can be thought of as the process of collecting participant insights through interviews, observations, surveys, or existing literature. Empathy maps can be used to reflect on and synthesize those insights, so your team can better understand who you're designing the improvement for. Empathy maps are most powerful when created collaboratively. Bring your team together to review what you've heard, fill in each section of the map, and discuss what the patterns could suggest. You'll start to see the system not just as a flowchart, but as something people are living and navigating every day. You can use empathy maps for more than just patients. Try them with staff who are part of the process, a medical assistant, providers who receive the follow-up, a scheduler, anyone whose experience could shape or be shaped by the improvement effort. And don't forget, research can support this work too. Looking at published studies or existing reports can help you identify common experiences or challenges in similar settings. These sources can validate what you're seeing, or reveal issues you haven't yet considered. Together, understanding the voice of the customer and using empathy maps help you move from assumption to understanding. They help you center your improvement efforts on what truly matters to the people involved. And that's what makes improvement work meaningful and effective.